Hi guys, Dr. Ashley here, and we are getting to know Dr. Michelle Haggerty, who is Fourth Trimester Doc. And so we are going to let her tell you a little more about what she does and who she serves and how she can help our community and be part of our village. So, Dr. Haggerty, tell us a little bit about your practice.
Awesome. Thank you so much for having me. I'm just so excited to be here. So I am Dr. Haggerty. I own Fourth Trimester Doc, as you were saying, and I am a family physician, boarded in family medicine, integrative medicine, and also breastfeeding and lactation medicine. So I have sort of this arsenal of tools that I can use to support people. And as the name suggests, I provide care for families in the fourth trimester or the postpartum period. And because I'm a family physician, I provide care for both the maternal or the birthing person and the newborn as well. And all of my care is in the home or virtual. So we come to the home, we provide all those well-child checks and those weight checks and all those jaundice checks and all those checks that we do for the that you would otherwise do with the pediatrician, but we do it in the home. And then also provide all the care for the maternal or the mother or the birther as well. So we provide like the blood pressure checks, and we talk about mental health, and we talk about nutrition, and we do sort of all those checks to make sure that the birthing person is thriving and not just sort of surviving during the postpartum time. So yeah.
And how convenient being in home, because postpartum is one of those times, whether we have a vaginal delivery or we have a C-section. Obviously, sometimes we have a little bit easier of a recovery or a little bit harder, but to be able to not have to leave home for you alone or having to have a little one kind of tagging along can make it a little more stressful, a little more challenging, hard with schedules and all those things. And to just be able to know that you get to stay home and have someone come in and you're not exposed to lots of things too. You know, baby's not going out and being in an area where people might be sick or where the weather is kind of crazy or whatever is happening. It's really, really convenient. Also, it does eliminate a lot of those other visits that you kind of expect to have postpartum. So baby's first sets of pediatrician visits and mom's checkups. And so about how long is that period that they are with you postpartum before, and then what happens when they transition, or who do they transition to after?
Yeah, it's a great question. So we usually actually start in the postpartum or in the prenatal period. So we do some postpartum planning earlier on. So we prep for what is postpartum going to look like for you and for the baby, and then we'll come in usually within 24 to 48 hours after you get home from the hospital, or after if you have a home birth or the birth center. And so we're coming in very quickly after that birth to make sure that things are going well and that the transition is going well and lactation is going well and all those things. And then we just sort of go from there. We see, usually it's another 3 to 5 days after that, and maybe a week later, and then around a month or so. And then we'll also do the 2-month well-child check in the home as well, and we'll do the vaccines if that's what you're wanting to do. So it's really nice to have those first set of vaccines in the home, because then you can snuggle your baby and you can breastfeed while you're doing it, and you can get all the questions answered, and we can kind of navigate what that looks like for you, so you don't feel really pressured in this 10-minute visit of trying to go into the pediatrician to do all that. And that, I really want people to be home. I want people to be healing. And for me personally, I was leaking from every orifice in the first several weeks.
That's what it feels like.
Right?
Yes.
Crying, my nipples were leaking milk. I was incontinent, right? And so like all these things are happening, and like to even think about going into the doctor, even if for the pediatrician and for those weight checks and things, was just it felt really hard
and exhausting. Yes.
Yeah, exactly. And actually, my practice was sort of born around when sort of COVID started in 2020. So that was, so yeah, I didn't want those newborns to be sitting next to somebody that was coughing and sick and all these things, right? I wanted them to be home, and I wanted them to be diaper buddies, I say, with everyone's skin to skin, like in their diapers, whatever. Everyone's just sort of like hanging out. So I love that. I much prefer that to be the situation than sort of dragging everyone into the clinic setting.
Yeah. So, and unfortunately, obviously when you go to the pediatrician, there's other reasons to need to be at the pediatrician, right? We do have sick kids. We do have, big things going on. And so you can't have just a well baby day and know that everybody's pretty healthy and good. So every time you are out, there's just more exposure to some things. And as we get bigger, it's nice to build our immune systems. But for brand new babies, not necessarily the best, as we're trying to get them strong and built to where they can get out there without having so much risk of of big things happening.
Exactly.
So obviously that's amazing for those postpartum months. And then at what point transition wise?
Yeah, so we transition then. Like I said, we do that 2-month well child check with the vaccines, and then typically after that is when we transition folks to whoever their pediatrician or their family practice physician is going to be after that. And so I can help find those pediatricians.
I was going to ask that.
Yeah. And typically I have sort of a whole host of people that that I recommend too, and it's great because I can kind of get a feel for the family and their sort of what they're looking for and what sort of type of pediatrician. Do they want to use their insurance? Do they want to do direct primary care? What are they sort of looking for? So we can help with sort of navigating all of that to make sure that you feel like you've got somebody that really sort of knows you. Knows you. Knows you.
Mm-hmm. Because I feel like, especially with first time moms, not that we don't, I mean, I had this with my second kiddo, like that, oh my gosh, I don't think that my provider is the best provider for our family now like in this season. But especially with your first baby, it's like, I might have some things that I do or don't want to do, or that might not fit every practice. So it feels kind of overwhelming in that world too. And that's one of the things that we love to do in our office is try to help match some of those things. But when you're able to be in the home and be able to see exactly what their goals are as parents and what their goals are for their kiddos and who kind of matches that kind of care style, it would be huge to not have to Google or look for testimonials or hope that who you're getting matches you. That's way more individualized care, really nurturing kind of care. So that's awesome that you can kind of help with that. Okay, so fun question. Tell us why. Like, obviously, as a primary care doctor, that doesn't usually look like a fourth trimester doctor that sees moms and babies at home. So what shifted you from that primary care model in that world into this fourth trimester doc model?
Yeah, it was a lot of things that sort of culminated together, but it really started when I had my kids. Like it was, I had my oldest is 6, I've got 6, 4 and 2-year-old. And, when I had my oldest son, I was postpartum and thinking, what is happening? Like, why is nobody focusing on me? I was having all my own sort of concerns, and it was really frustrating feeling like everything was so focused in on my baby, which of course I wanted them to be healthy, but I also wanted somebody to acknowledge the fact that I had gone through this huge transformation myself. I like the term matrescence. You've heard that? So it reminds the adolescence, but it's this birth of a mother, a birth of a parent. And like all these changes happen, social changes and hormonal changes and physical changes and environmental changes and all these changes that happen all at once. Expectations and
your role changes. Your relationship between baby and between husband and all those
grandparents
things.
And everything, right? Like and you're like how you present in society even looks differently, and your friends and all right. Financial things change, right? Everything changes, and so there's this huge shift that happens, and I feel like it's just not really studied, acknowledged, supported. I mean, all the things, right? And so I found this, and on top of it, people are dying, frankly. So our maternal mortality rates in the U.S. is horrible. And they actually show that over 60% of maternal deaths happen postpartum. Yes. Over 60%.
Which I don't think most people know about, because some of us are starting to hear more about just, especially because there is some cultural differences and things like that. We're starting to hear a little bit more about that. But I really do think that the only people I've ever heard concerns about is in birth, right? We think that maternal mortality is all about in birth or having something or in pregnancy something happening. And so you don't hear about the fear or it even happening postpartum. Like once you have the baby, you think you're okay.
You're like, you're sort of made, whew, and that's what the medical that's the standard medical system sort of treats us like too, right? So we have all of these visits during the pregnancy, right? Like so many visits, and then up to leading up to the birth, so many visits, and then you're, if you're in the hospital system and you give birth, and you're 24 hours of care for several days, and this whole thing, and then all of a sudden you're just sort of sent out, and so which is it's crazy to me, and then when we're looking at over 60% of maternal deaths, over 50% of those deaths are in the maternal deaths are 7 days to 1 year postpartum.
Oh my gosh!
So so it's not even in the first initial couple days where we're talking about hemorrhages and things like that happen that
we do kind of check for right after.
Exactly. All these things are more people are really concerned about is the immediately after, but it's that 7 days days to a month or to a year after.
Wow.
That is really scary. And again, we only have this 1 6-week visit, which
Yes.
is just
Yes.
like, again, crazy to me. I keep saying crazy, but it's just like,
It is. And if you're a mom going through it, just personally, it feels like a very quick visit.
It's a very quick
For
visit.
the only thing that you get postpartum,
Exactly.
right?
Yep.
And it might be because they're only looking for a couple things, but it doesn't feel very encompassing or very
they're supposed to have
holistic.
a whole set of things they're supposed to look at, but you only have 10 minutes.
Yes.
So like there's ACOG, the American College of Obstetrics and Gynecology, actually recommends this like huge list of things to go over: mental health, physical, pelvic floor, intercourse, contraception, all the things. But like, when your physician only has 10 minutes, like how do you do
just
that?
the most severe things that you
Exactly.
might check for or ask about. Yeah.
And so really it's like, you have your birth control and now you can have sex and exercise. Great. Yeah.
Oh my gosh.
Awesome.
You're not hemorrhaging right this
Right.
second.
Cool. So
gosh.
so like it's really challenging, right?
Yes.
So I personally felt like it was missing with my personal care, and so and then I tried to do that in the system. I tried to, when I was working in a clinic, I tried to do home visits. I tried to have longer visits. I tried to like see people more frequently. I tried to do all these things, and I was fighting the system too much, and so I just had to get out. And so now my visits are, an hour to an hour and a half in length. I get to go into the home. I get to be, it's
You get to the whole list?
Yeah.
The whole list.
I do the whole list. I mean, people have access to my phone, like text messaging directly. So they get support. Like when if you have those crazy thoughts in the middle of the night about whatever it is.
Yes.
So just text me in the morning. Let me know what you're thinking. Let's just try to
go through it.
Yeah. Is it a legit concern? Is it something that we need to address? Is it something that is, you can figure out differently? I mean, whatever it is, it can be, you don't
You're
have
not
to think
alone.
about it.
You're not alone.
Exactly.
Right?
You don't have to try and call into a nurse line and find out 7 days later that you have an appointment 2 weeks later or whatever it is. So it's just all the things just make it more. You're just more held, more supported, more cared for,
if there are some of those big things that could happen between the 6 weeks and 1 year, you're there, right?
Yeah, exactly.
And so if there are those things and I will say also, I'm kind of the opposite of that thing that doctors hate, where, the mom is worried about everything and calling a million. I'm that person that's like, I don't want to bother them, right? I don't. Right. So the concerns I had, I'm Googling and it can't be death, so it must be okay. But what if that was a big deal? What if those symptoms or those signs were things that if I told the doctor, I would be something on that list that could be dangerous, right?
Yes, yeah.
And so to know that it's like, okay, I'm not bothering her. We have these already set up visits. I know that I'm taken care of. She wants me to ask those questions because she doesn't want to miss those things either, right? Yeah. You just feel like you have a space to be able to ask the questions. And even just, it's not a question, but I was wondering, I just don't know. I'm a new mom and I don't know, is this normal? Is this not normal? Like when we're leaking from everywhere, and what are the right things to use and what kind of things can help, during this transition time of figuring out who I am, and sometimes 100% mental health that you can manage, right? Because you are able to prescribe if that's necessary. We are able to take care of that. Or if we need to say, okay, here's a great therapist that has gone through exactly, is focused on exactly what you're going through, and you can make those connections as well. So being able to be fully encompassing, and not be scared. Some of that mental health things as a mom, you're kind of scared to say, I've thought these things, is that normal? Or is someone going to come take my kids away because I've had that thought, right?
Exactly.
That's scary.
Yeah, exactly. Yeah. And being sort of trained in integrative medicine, I also have this whole set of tools that, yes, medication is fabulous. It's awesome. I love it. We use it, but also there's all of these other things that we also use and are fabulous and are wonderful as well. And so it's all part of the sort of the toolbox. And we pick and choose what feels right to you and what resonates. And so we're able to sort of navigate all that. So yes, and that's, I should add that too, is so I do perinatal mental health consults as well. So as
wonderful, even
if they're not part of my sort of fourth trimester package or the getting that regular care with me anyway, I also do those consults separately. And then I also do breastfeeding and lactation medicine consults as well. So if there's something that's complicated with lactation, you've been seeing a lactation consultant or having complications with lactation for whatever reason, then we are able to support that. And so, recurrent mastitis, hypo or hyperlactation, all these sort of issues that happen, a breast abscess.
And that's what I was going to say too. Even if you are seeing a lactation consultant, if it's something that does require medications or something that might might need a little bit more, a little bit more involved, that we do need to have a medical provider, not just a simple, well, you and baby can kind of handle this in the process. There's a little bit more going on. You're able to handle that as opposed to going into the hospital or urgent care, or once again, places where there might be a lot more exposure to some other things. And someone who that's not their specialty necessarily,
exactly.
right?
I was going to say, a lot of times what happens is people get referred back to their pediatrician or their obstetrician, and unfortunately they're not trained in breastfeeding and lactation medicine. They have very minimal training, a lot of them, in lactation. And so I just had one today that was, the new guidelines did not prescribe antibiotics for mastitis, and they were just prescribed antibiotics. I'm like, no, you don't need to start that. That's not the first line. And so it happens quite frequently that people are sort of referred back, and really it's, they should be seeing us instead. So, just to know that you have somebody that really knows what to do. And once again, is going to be more of that nurturing, has the time. It's not a quick in and out visit with someone who this isn't their thing. Not that they don't want to care for you, but if that's not what's in their toolbox, they just don't have the tools to be able to manage that kind of thing. So if we have a mom that does have some of that postpartum mental health, then I really do want to talk to someone when I don't know where to go. They're not necessarily with you. They already have a pediatrician, but we can just come for that consult, see what would be the best set of tools to be able to use it, whether with you or someone else. That's super wonderful. And same thing for lactation. So if we're man, we are struggling and I feel like I just need a little more support than what I either have, or I don't have anything yet, but this sounds more like what I need. Wonderful. Because it's nice to be able to kind of have some of those separately if we're already at a different place or in a different stage, right? Different stage. Yep, exactly. Yes. And I will add too, also paternal postpartum depression and anxiety. So we also treat that as well. Okay. So that is, and we have a sort of host of therapists that we refer out for that connection too. So it's not just the maternal side. It's also, we also address and treat the paternal side. I
love that, because we never hear about. I mean, that's just not something. We're starting to hear a little more about men in general having, depression or anxiety, which before we didn't hear a whole lot of that. It probably did happen, in offices and behind closed doors, but it's nice for that to be kind of, it's not just you, right?
It's much more common than we think, than what people in the general society sort of address, right? And so, it's really important, and it usually starts around 6 months or so postpartum, but it's an important thing to be, acknowledging and addressing. Yeah, and so that it's not like, okay, I'm just going crazy. This really is a thing. They did not obviously physically have the pregnancy and have a birth process and all that, but they also have some big changes in their position in a family and in their lifestyle and all of the different things. So there's some big things big changes and big things that can happen. So I'm really glad that you brought that up. It's not even something that I would have thought about. Not that I haven't seen it, but it's not things that I would have thought. And that means that you could be taking care of mom, dad, and baby in that process. Exactly. So sometimes it can be, a little bit more encompassing than what we've even known. Well, it's family medicine at its best, really, is what,
So your why is very much your birthing,
my personal experience, and then the other, I should add, the other side of it is that I personally, and you may see this in the healthcare system in general, is that physicians are getting burnt out. We're getting, and I prefer to use the term moral injury, because I think it's being put on them and not something that they're not inherently able to sort of deal with. We're some of the most resilient people on the planet. There's no reason why we need more resiliency. We just need people to not be putting all these pressures on us. And so these 10-minute visits and these
hundreds of patients in a day,
and just this really, there's a lot of all these my chart messages and all these things. It was getting to be too much, and I just was like, I didn't feel like it was actually providing healing and support and connecting with patients in the way that I wanted to, and clients in the way that I felt I wanted to be able to connect with them. So my personal, sort of goal and reason why I went to medical school was just being taken out from under me. So I felt like I needed to just break out of there and be able to provide care for people in the way that I feel like they needed to be treated, and also the way that I felt like
to provide the care.
Provide the care. Yes, exactly.
That's so wonderful.
So it's been a great journey. It's been,
I love that. It's huge. And I feel like most of the people that I work with, our practice works with, our moms work with, the providers who give the best care and the most nurturing, it's because we've been through this stuff, right? Like we do this because, you know, I was not planning on being a chiropractor ever. I was going to law school. Like this was so, I'm like, no science at all. None of it. But after getting hurt and watching my kiddos go through, birth trauma, spectrum disorders, sensory processing, my son with a brain injury, like, oh my gosh, this was another, you know, I wasn't seeing what I wanted to see in the world of how we can help and deal with these things either. And then seeing what it did do. And it's like, okay, I want to be able to make sure that all kids and all families and all pregnant moms and postpartum moms have access to this as well. But I think you are a different kind of provider when you've experienced it, right? Not just going through school and saying, yeah, and it's not that that's not important. Like, yes, I do want to help people, but it's different when you've needed the help or when you've
we come at it from a different angle then.
Yes.
You know, like you can come at it from, like, you sort of understand.
You understand, yes. It's just completely different. So I love that your story is very, from a personal standpoint of, I needed that type of care, right? I saw where there was a piece missing that I really could have used. And the type of care that I was able to provide in the environment that I was in wasn't what my dream would have been, right? I wasn't providing what I wanted to. So it's awesome to see you're able to put that together, and now moms and families do get to have that kind of care that wasn't really available. So thank you for providing that. It's huge that it's available here.
And like I said, I love it. It's, you know, it gives back to me every day. I feel, I mean, at the end of the day, I feel energized and I feel like I've got, you know, this energy sort of built up in me and not sort of drained. Which is what, you know,
amazing. Amazing. Awesome. So obviously moms, families, moms to be that are looking for their teams and their village and their providers, if they want to get a hold of you because they're like, yes, this is my person. I want to know that I'm already taking care of postpartum, so prenatally already, or even before, I want to already kind of put my team together. What is the best way to connect with you, to work with you, to find out more information? What's the best way?
Yes, absolutely. So the best way is actually go to my website. You can fill out contact information there, or you can just even sign up for any of the packages or consultations and things. You can just do it all right from the website itself. But then I'm also on Instagram and YouTube and Facebook, and so like a lot of social media outlets as well. So I'm happy to connect there. And yeah, I mean, so Twin Cities is where I do the local in-home visits. We do have 2 other physicians that work under me right now that are also doing visits in the Twin Cities as well. So there's the team of us. Yep, exactly. If you're outside of the Twin Cities, we can do virtual visits or coaching as well, postpartum coaching. So that can be really supportive too. So
wonderful. Yeah. And then I will have your website and the social media links and all of those things on everywhere this video will be. So people will be able to just go ahead and click whatever links are easiest to connect and get to know more or be able to work with you based on their time frames of when things are happening. Yeah. So thank you.
We would be
so
honored.
much.
We just love it so much. So it's just such a gift.
It is. It's amazing to be able to work and serve this population of moms and be able to know that we're providing something that otherwise, we just didn't have. I didn't have when I was a young mom, and so many of us didn't have, and I'm so thankful that you are doing what you're doing and we have what we have. So thank you so much, and thanks for taking the time to be able to talk to all of our family. Yeah. All right, guys, thank you so much, and we will see you next time.